Welcome to Face to Face. If you are an Indian American, Indian, or South Asian, and if you are ever either 50 or even 40, you must watch this interview with Dr. Raj Devarajan. He is going to explain the concept in the very beginning in a great detail, and then we will carry our conversation. Raj, welcome to our show.
Thank you for having me.
And thank you very much for your time. I really appreciate it. So before we get into this interesting topic, we had several rounds of chat off the camera that why Indians or South Asians are as much risk after 10 years in the United States for colon cancer as anybody from the United States is here. So many Indians assume that, well, I'm vegetarian, I live in India, we never heard of colon cancer there. So I want to, before you explain all this puzzle and see how we can deal with this, just tell us a little bit about yourself,
Okay, thank you. Thank you for having me. And I think it is an opportune time to discuss this because there have been some changes that I will discuss in regards to colon cancer screening. My name is Raj Devarajan, and I'm currently the president of the Massachusetts Gastroenterology Association. Each state has a medical society, and so Massachusetts Medical Society is there, and they of course publish the New England Journal of Medicine. And in that society, you have subchapters of each specialty. So in gastroenterology, I happen to be the president currently. I'm also past president of the Emerson Hospital medical staff, and I'm the president of Middlesex Gastroenterology and Endoscopy Center. Furthermore, I have been involved over the last 15 years as the president of the American Association of Gastroenterologists of Indian origin. So there are a lot of Indian physicians in America, and each specialty has an organization capturing the talent of these Indian American physicians. And so in gastroenterology, we've been running this organization. It's a nationwide group, and we pool our collective wisdom and try to help others, etc. So I've been doing that as well on a national level.
Is that part of API or it is independent?
No, that is not part of API. API is all physicians, and we have, of course, some associations, but we're not part of it.
Okay, I just wanted to clarify that. Sure.
Right.
Okay, so now let's get into off the record, as you were mentioning about that we Indians or South Asians are as much risk for colon cancer as any American here after living here in this country 10 years.
Right.
Why that happens and how?
Correct. So I've been in practice for 25 years, and I've noticed even 20 years ago that diseases that were uncommon in India, such as colon cancer, such as Crohn's disease, ulcerative colitis, I was seeing a lot of that in the Indian American population. This was 20, 25 years ago. But we couldn't quite place why that is. We suspected that it might be the environment, and since then this has been codified in various studies that show that people from India, or any other country for that matter, who have immigrated to the United States and they have been here for 10 years, they will have the same incidence of diseases of what was traditionally American or Westernized diseases. So, and that's been well documented. And furthermore, we're seeing that even cancers in this country are on a rise, not just on a rise, but on a rise at an earlier age. So some of these reasons have to do with the environment. And when I talk about environment, I'm also talking about processed foods, specifically processed
And
foods.
we are talking in the context of colon cancer or everything?
Colon cancer specifically.
Specifically,
But this model can be used to explain the spike in all cancers, the spike in Indian Americans who traditionally don't have these diseases there. In fact, it can be substantiated because even in India, the diseases that were not so common before are now common in India. People who have never left the country. And a lot of this has to go back to I don't know how many years you've been here, I've been here. I grew up here in Connecticut and went to medical school in India. But when I was there, I noticed that we used to get food every day by vendors in front of your house.
Sure.
They'd bring fresh vegetables that were cut that day, fresh chicken, fresh eggs, milk, etc. In fact, we used to boil our milk because they were not even it wasn't even pasteurized.
Sure.
And we would buy enough for that day. We would cook, we'd eat, and done.
Yeah.
There's no refrigeration.
Sure.
In fact, there are studies in Europe now discussing exactly that. What does refrigeration have to do with how foods are transformed and how they may hurt us? So none of that existed in India 30 years ago. Now, as India has become more westernized, people are going to the supermarkets. They may still have an Indian diet, but they go to the supermarket to buy their ingredients or even made food, and they eat that, and then they save some because they're all busy. They take some for lunch, they keep it for next day dinner. So all of these processes are influencing the spike, even in India, of these diseases.
Yeah. Now, before we get into further more details, the causes and other stuff about colon cancer, I just want to ask you one thing, which I have been going through this myself, is that every time I have my physical, I'm above 50, and every time I have my physical exam, doctor always comes and says that, you have to done your colonoscopy done. And I avoid it. I said, look, then again, next time I go, I avoid it. And the reasoning in my mind was that, look, I never heard of this in India, I'm a vegetarian, I'm a healthy man, and why should I get it done unnecessarily? So I'm sure that so am I doing the right thing or I'm doing the wrong thing?
You're doing the wrong thing.
Okay.
So there are three reasons why, as you justified, why you're not getting a colonoscopy, and I will counter those three reasons. One is whether you're a vegetarian or non-vegetarian, it doesn't matter. You can be a vegan, it doesn't matter. Unless you have your own farm, you grow your own vegetables, you grow your own chicken, you grow your own cows to drink the milk or eat the meat, you're not going to avoid the influences of the environment. And that's just not possible. And even though people have this thing about getting organic foods, etc., that's good, but there's always some processing that's happening. There's a reason why chickens are this big here and they're this big in India.
Yeah, exactly.
There's a reason why tomatoes, onions are all nice and healthy and red and perfect to look at and take. There's a reason for that. It's all been influenced, and that influence is going to affect you whether you're vegetarian or non-vegetarian. Second, you said that you're from India. You never heard of this. I just told you that even in India it's rising.
Now it is.
And if you lived here for 10 years or more, you have the same incidence. That's documented. So the third is that you say you're healthy. Well, colon cancer is not going to present itself until it's too late. In fact, once you have symptoms of colon cancer, you're in an advanced stage of cancer. Every cancer has stages. 1, 2, 3.
So let's first start a little bit of the symptoms. Like what are one or two basic symptoms
of cancer?
Colon cancer.
Well, if you have colon cancer, you'll have bleeding, you'll have obstruction, where you'll have vomiting, and you can't get things through because there's a big mass or cancer obstructing the colon, and you may be losing weight. So these are all late stages.
Okay, sure.
And so you want to basically prevent colon cancer. What people don't realize, or maybe even some doctors don't realize, is that the only preventive test for cancer is colonoscopy, to prevent colon cancer.
It includes all types of cancers.
Yeah, there's no other preventive test. If you want to, women get mammograms, it detects breast cancer, and it's already there. You get a chest CAT scan if you're a smoker, it detects lung cancer. You get a PSA screen for prostate, If it's high, you already have prostate cancer, and so on. So it is detecting cancer. It's not preventing it. There's nothing to prevent it. So colonoscopy, the way it prevents colon cancer, is that how colon cancer occurs is by the initial stages is a benign. Benign means not cancerous.
Sure.
Benign lesion called a polyp. In fact, I've had patients say, "Oh, it's fine. I just had some polyps." Well, that's the whole point of a colonoscopy, is to remove these benign lesions so that they don't advance to colon cancer. So if you were to have a colonoscopy, and if it was a good prep, and we can talk about that in a second, if it was a good prep, and you had a good endoscopist, and you had some polyps, and they were removed, you will never get colon cancer.
So like when you just talking about the process, for example, so if I'm going through colonoscopy and you see all these polyps and all, is it removed at the same time,
Yes.
or the patient has to come?
Same time.
So, and how long the process takes, roughly?
The colonoscopy?
Yeah, just tell us about the process, the entire process from...
So the entire process is that, it used to be that you used to see a gastroenterologist before you get a colonoscopy. Now you don't do that. It's a direct access, meaning your primary doctor says you need a colonoscopy. You call our office or some other office, and you say, I want a colonoscopy. You get booked for a colonoscopy. They'll ask you some screening questions to make sure that, if you're on blood thinners, etc., when to stop them and all of that.
Sure.
Stuff. Once you do that, you get booked. And when I meet you would be at the time of colonoscopy. So the day before the procedure is often the worst because of the preparation. And it's unfortunate, many people avoid colonoscopies just because of the preparation.
Sure.
They also avoid it because they think it's something invasive. Some people feel it's, they are shy about getting a colonoscopy. These are all not valid reasons. But anyway, those are the reasons some people avoid them. So the day before the colonoscopy, you will take a preparation which we prescribe for you, which will basically empty out the colon. Because when we are in the colon, which is the large intestine, we need to have a clean look so that we don't miss anything. Polyps or benign tumors can be in the shape of a mushroom, or it can be very flat, or what we call sessile polyps. And if your prep wasn't very good, we could miss some of these flat polyps, which could be very serious. So we do the prep, and then the next day you come in for the procedure. You come in a place like mine where we do it right here. You'll talk to the nurse. They'll get some history. They'll put your IV in. You'll talk to the anesthesiologist, who will tell you about the anesthesia they're providing for you. And then you get taken into the procedure room where I will be there. I'll also talk to you, get your consent. And then when you go into the procedure room, you get medicated. And there's zero awareness because we use propofol, which is a very good sedative that knocks you out in 4 seconds, and you're comfortable, pain-free, and we do the entire procedure. And the good thing about the sedation we give is that when you wake up, you'll wake up in 10 minutes after you stop giving you the medication, and you'll be fully alert. And so we do the procedure, take out any polyps, whatever it has to be done, and then you recover another 20 minutes, and then you go home. And
so now, if you have to remove the polyps, how will you remove the polyps? You have to do some surgery, or it is?
It's all internal.
It's all.
Surgery is traditionally described or defined as cutting skin and going in.
Okay.
We're not doing that because we're inside already.
Okay.
So through the colonoscope, the flexible instrument that I use to perform the colonoscopy, we have certain tools that go through channels to open up and capture these polyps and cut them. And if we have to inject them, we can. We have various tools to take care of anything that happens.
Excellent. Now let's talk a little bit about gender. Men versus women. How much at risk women are and how much at risk men are? Is there any difference or the same risk?
So if you take a look at deaths from cancer, colon is still number 2 in terms of death from cancer. Number 1 is lung. And if you take men and women, it'll be lung. Number 2 will be, colon, breast, and then colon, for women, prostate number 3, and so on and so forth. But if you take a look at deaths from cancer among men and women, you're talking about colon cancer.
So, are the women at more risk with colon cancer, or men are more at risk?
Men are at more risk.
More risk. Okay. What about let's talk about the age as well. So, like the primary care physician, he starts saying after 50 you should get it checked. What is your recommendation?
It's actually 45 now.
Good.
The American Cancer Society has moved it to 45, and we as gastroenterologists have been predicting this for about 10, 15 years now, because we've been seeing a lot younger people with cancers who did not meet criteria for screening. Our criteria for screening a few years ago was if you have no family history, because family history increases your risk. If you have no family history of colon polyps or colon cancer, then you start to get screened at age 50 for men and women. If you had family history, your father, brother, aunt, uncle, whatever, then you would get screened at age 40. So that used to be the guidelines. Then we started seeing cancers at 35, 38, and with no family history. The youngest cancer in this office we diagnosed was 28.
28?
Yeah, colon cancer, with spread already. When I say spread, I mean an advanced stage of.
So the colon cancer can start small in a simple way, and then it can spread all over.
Every cancer, that's what happens.
That's right.
It starts out small, gets bigger. When it gets bigger, it invades the wall. When it invades the wall of the structure, whether it's colon, breast, or lungs, or whatever, it hits the bloodstream. When it hits the bloodstream goes everywhere.
Yeah.
So these cells go everywhere. That is what we call spread of cancer. So we've been predicting it, but the American Cancer Society and National Preventive Task Force do not make changes lightly. They wait to see years of data before they make a change. And American Cancer Society this year said, no, we got to move to 45. Which means if you have family history, it's 35. But we've always had this caveat. How we found this cancer in a 28-year-old is, you have symptoms, you come in, and if you're below 40, we used to sort of treat it as, okay, it's probably functional, hemorrhoidal bleeding and things like that. But now we're more aggressive. If you come in with symptoms, we do a colonoscopy.
And how often it should be done, colonoscopy?
So if you have, again, a good prep, a good endoscopist, and you have no family history, and you have a colonoscopy, and there are no polyps found, then you don't need another one for 10 years.
Okay.
If any of those factors are different, then your doctor will tell you when your next one should be. For instance, if you come in, you have no family history, and I find, 5 polyps, you'll come back in 1 year. If you had 1 or 2 small polyps, I'll say 5 years. And it depends on the size, the number.
And you make the recommendation.
We'll make the recommendation as to when you should come back.
So now if somebody, is watching this and listening to our interview, and they say, look, I'm really scared and I want to take care of myself. Is there any way to avoid, take care of yourself so that it doesn't happen to you?
So
preventive measures, what are the preventive?
So one is that the only recommendation we have is to have a very high fiber diet and low fat diet. And that, by the way, is helpful in all respects, diabetes, hypertension, heart disease, etc. But that is the only thing that has been shown to be somewhat protective. The second, which is unattainable to the majority of people, is to have your own farm and eat your own food, which is
difficult, sure.
At best. So those are the only two. There were some studies that showed taking some non-steroidals if you have significant family history in women, but I really don't want to say that because I don't want people taking Motrin or Advil or anything like that. That has no recommendation.
So now, lately I have been really reading or listening a lot about some bugs in your gut, something like that, right? That or some bacteria in your gut are very, they play a very important role in your overall health. So, and I think it's very close to they might have some impact on colon cancer and other part of the. I'm not a medical guy, so I'm just asking these dumb questions, but.
No, they're not. It's not a dumb question. In fact, it's a very opportune time to be talking about this. But before I answer that question, while we were talking about colonoscopy screenings, let me just tell you that, as I had said, colonoscopy is the only one that prevents cancer.
Sure.
And we have shown that by, if you see the rate of colon cancer over the decades,
Mm-hmm.
you'll see where there was a dip in the cancer incidence.
Mm-hmm.
And these dips always follow several years after a celebrity has a colonoscopy or a colon polyp. In fact, the very first dip in colon cancer recorded was in the 80s after Ronald Reagan had a colonoscopy and he had some polyps removed. So everybody said, oh, I should do that. And they went and had colonoscopies. So a few years later, you see a reduction in the colon cancer because the polyps were removed in millions of people, and so now the colon cancer incidence drops. And if you look at the next drops, there was Darryl Strawberry, the baseball player, but the biggest drop ever recorded in any cancer incidence profile was Katie Couric had her colonoscopy on television. And she's, of course, very popular, and a lot of people follow her. And they said, okay, if she can do it, I'm going to do it. And 4 or 5 years after that, we saw a ridiculous dip in colon cancer incidence. So that goes to show you how preventive.
Well, I'm getting inspired to get mine done after so many years.
So anyway, so that is a very.
So let's come back to the gut bacteria.
So what you're talking about is what we call the microbiota.
Yeah, exactly. Yeah.
And the microbiota is a group of bacteria that we all live with. Every human being lives with 7 trillion bacteria in their body.
7 trillion.
7 trillion. And this is what we call a symbiosis, meaning we don't hurt the bacteria doesn't hurt us. And in fact, the bacteria helps us. The bacterial flora helps us in different metabolic pathways that is too complex for this discussion, but I can tell you that we live in symbiosis. The change or destruction in this microbiota has had far-reaching consequences for health. Our bodies are changing. What is remarkable is that our genetic code that we were born with changes. So this microbiota can actually affect changes in our DNA. So if you, over time, live in this environment, eat this food, and your microbiota changes, your children now have a DNA code that is going to follow.
It's so fast.
Yes, and that is the most remarkable thing. So what we don't understand is what microbiota each particular individual needs or benefits from. I can't tell you, these probiotics are a dime a dozen. You have 100 different probiotics in the pharmacy or the grocery store. Probiotics is, obviously bacterial flora that you're taking by a tablet, and it's to build your bacterial flora in your gut. What we don't know is which probiotic to give each person. Patients ask me, I say, try anything, try 1 or 2. So, because we don't know which one will help you. The science behind that is being evolved. So studies on the microbiota and how it influences our health and causes disease is intense focus right now. So it's not a dumb question. It's a very opportune time to be talking about the microbiota.
So now they also have a big impact on your body, right? And including DNA and all the structures, genes. What about mind? How do they affect mind as well?
It affects every system in your body. Every part of your body depends on this microbiota. They depend on it. In fact, the vast and somewhat inappropriate usage of antibiotics in most countries now is hurting our microbiota. People get a viral infection, they have a cold, they have busy lives. They want to get over it. So in 2 days they say, "Oh, I'm going to take antibiotics," and they take antibiotics. You really didn't need it because it was a viral infection. Viruses are not affected by antibiotics. Only bacteria are affected by antibiotics. But you take antibiotics. And over time, the viral infection is going to go away. You're going to get better. You think it was the antibiotic. So next time you get that, you're going to get another course of antibiotics. And what this does is continuously destroy the bacterial flora that you've been living with, you know. So that is going to cause more disease eventually, over time,
So
as a generation.
Sure. So now here I briefly toured your facility here. It's amazing that all the stuff you have is very state of the art. Tell us a little bit more about your practice here in this place.
So we opened, outpatient endoscopy centers are really the mode of providing this type of service in most of the country. Massachusetts has been more reluctant because the most powerful hospitals in the world are in Massachusetts. And hospitals do not want to see these procedures being done outside. So they passed a moratorium on building outpatient centers like mine 13 years ago, and none have been built since. And it's a shame because one, the patient experience is better. It's an outpatient setting. Number two, the costs are 1/3 of the hospital-based costs. And that's why the hospitals want to keep it in the hospitals. And it makes no sense. But there are several sort of measures in the legislature now trying to address healthcare costs. If you look at any company, any state, even the country, what is buckling is the healthcare costs. And how do you provide excellent care like Americans expect and deserve, but to provide it at lesser costs? And so we opened this 13 years ago. It's been very successful. In fact, many gastroenterologists who were in other practices have moved here into our practice. So now we have 7 gastroenterologists in the practice and a nurse practitioner. And we do, on an average, 50 procedures a day.
Which is quite a good number. That's 50 is a lot of numbers. Yes. Okay. Now, also, so this is the only facility you have? You have some other?
This is the only facility I have. There are other facilities like this around the state that were obviously...
No, I'm just talking about yours. So this is, you started 13 years ago, this one. And now as we come towards the end of the interview, I would like to ask you for your last word about colon cancer and colonoscopy.
Yeah, it's a no-brainer. I mean, if you look at what all we've been talking about, it's a preventive test. You only have to have it once in 10 years if you don't have family history. If you have family history, it's once in 5 years. And it is painless. It is the only test that actually performs therapeutics, that is to remove polyps. You may get CAT scans and other things, but they may detect it, but you won't detect polyps, only at the later stages. So I think it's a no-brainer. I think that if you find educated communities have a higher incidence of colonoscopy screening and a lower incidence of colon cancer. This has been shown throughout the country. You have highly educated populations, they get their screening, they seek health care, and they have a lower incidence of cancer.
Well, I'm very highly educated, I think so. And I always avoided this. So I think there is still big ignorance. Even the people like us who are said, look, I don't need it, or they're scared or somehow.
Well, a lot of it is, we're all busy and we think, well, if it doesn't hurt, it doesn't bother me, let me get on with my life.
Have you thought about doing some sort of a campaign I think it's a great public service to educate people, the importance of this, what you were saying.
Yeah, so March is Colon Cancer Awareness Month, and there are various campaigns that undergo throughout the year and in March where the societies, that is the GI societies, gastroenterology societies, medical society, cancer society, tries to send out this information and educate people. And forums like this where we can actually reach out to
Sure, absolutely.
your audience
Sure.
to let them know.
Yeah, no, we are going to we'll do our best to create some awareness about this issue. And last thing before I let you go, it's all covered by insurance, depending on your healthcare insurance you have.
Yes, it's the Affordable Care Act mandated colonoscopy as a right, so it's covered by all insurance,
By all
including Medicare and everything.
Okay. Well, Raj, thank you very much for your time, and what a learning experience, and you did inspire me to go and get my colonoscopy done. I might call you.
All right.